Commonly, COPD is a result of smoking in which Peter has done so for approximately 40 or so years of his life. Hypersecretion, known as high levels of mucus production, is a characteristic of COPD, which causes congestion within the airways and inability to breathe effortlessly, known as dyspnea. Alternatively, Peter, whom suffers from COPD, may feel the need to cough as this mechanism assists in removing mucus out of the airways. Another reason why Peter may be experiencing dyspnea is due to his weight of 95 kilograms and his waistline of 104 centimeters. Due to his excess belly fat, known as visceral fat, this can impede his normal breathing ability due to applied pressure to his diaphragm and chest cavity, making it more difficult for his lungs to fill with air, whilst the visceral fat too restricts blood supply to vital organs. Breathlessness and feeling fatigue is a result of impeded breathing, in which Patrick is clearly demonstrating.
Patrick's current observations show that his heart rate is at 155 beats per minute, which according to the government-funded service Health Direct, drastically exceeds the normal health range of 60 to 100 beats per minute. If Patrick's increased heart rate has been present for a long duration, it could indicate that he is suffering from tachycardia. There are several factors which could have contributed to Patrick's elevated heart rate, including his medical history and body measurements. His weight and height categorizes his BMI of 29.3 into the overweight grouping. A person classified as overweight produces an increased amount of blood volume due to the increased demand caused by the excess body fat. With an increased demand, the heart is having to pump harder to deliver oxygen-rich blood throughout the body. Patrick's medical history identifies that he was a smoker from the age of 20 to 60 and that he experienced a myocardial infarction to a branch of his left coronary artery at the age of 68. Based on the current observation data that Patrick presents, it is likely that his myocardial infarction was due to an increased heart muscle cell demand for oxygen, which subsequently increased his heart rate. Research shows that smoking increases the heart rate of young smokers and tightens major arteries, causing long-term damage to the heart. Due to the vasoconstriction caused by the nicotine, Patrick's heart would have had to work significantly harder to pump blood throughout the body. Patrick has also been diagnosed with COPD, which is presumably caused as a result of smoking history. The low amount of oxygen circulating the blood creates a strain on the heart, which can ultimately worsen Patrick's risk of heart failure. His blood test results also display factors for his increased heart rate. His potassium levels are exceeding the average range, and abnormal amounts can interfere with the electrical signals in the muscular layers of the heart and can cause an abnormal heart rate and irregular heartbeat.
COPD includes emphysema and chronic bronchitis. As mentioned previously, the main cause of COPD is long-term smoking, whether it's active or passive, which Patrick had been doing for 40 years of his life. Long-term smoking can cause damage to the alveolar walls and break down the elastin in the alveoli, leading to decreased elasticity and alveolar collapse, resulting in emphysema. The constant irritation from smoking may also have caused chronic inflammation of the bronchi, resulting in excess mucus production, leading to chronic bronchitis. Patrick also has left-sided heart failure, where the left side of his heart is unable to pump enough blood to meet the body tissue oxygen needs. Left-sided heart failure is mainly caused by systemic hypertension or myocardial infarction. Patrick's current blood pressure is quite high at 135/85, but it is not enough to classify him as hypertensive, which is a BP above 140/90. However, Patrick did have an MI to a branch of his left coronary artery at the age of 68, which is most likely the cause of his current left-sided heart failure. An MI can cause left heart failure due to the adaptive measures the heart takes to compensate for the insufficient cardiac output. These adaptive measures cause the further progression of heart failure. These adaptive measures include ventricular hypertrophy and dilation, as well as the activation of the renin-angiotensin-aldosterone system. Due to Patrick's MI of his left coronary artery, his left ventricles may have increased in size due to the heart cells getting bigger to compensate for the cells he's lost. This is known as left ventricular hypertrophy. Collagen is deposited between the cells to support the larger muscles. However, collagen is not a very contractile tissue, and as a result, contractility is decreased. This leads to dilation, where the ventricles become enlarged due to the decreased contractility. These changes cause preload to increase. The insufficient CO caused by Patrick's MI and weaker heart contractions would also cause the activation of his RAS as the blood flow to the kidney becomes lower in priority to the brain, heart, and lungs. This will be detected by the kidney, which would cause an increase in blood volume and blood pressure due to the RAS. This increase in BP and BV results in the increase of preload and afterload. Overall, this increased preload, increased afterload, and lower contractility caused by these adaptive measures means that an increased volume of blood is being pumped with a weaker heart against more resistance, resulting in left-sided heart failure. Furthermore, blood will begin to back up in the lungs and cause pulmonary edema, a buildup of fluid in the lungs. As mentioned previously, COPD mainly arises from long-term smoking, while congestive heart failure arises from an MI or systemic hypertension, which doesn't arise from COPD. The developments are not directly related to each other, but they can influence each other. For example, pulmonary edema from congestive heart failure can worsen dyspnea from COPD as fluid builds up in the alveoli. Likewise, the low oxygen saturation level of the blood from COPD can put extra strain on the heart from the lack of oxygen and worsen the strength of the heart's contractions.
Right-sided heart failure is caused by an ineffective right ventricular contractile function. As a result, the blood isn't effectively pumped through the right ventricle and into the lungs, resulting in a decreased cardiac output. This consequently causes a buildup of blood within the right atrium and peripheral circulation, and can initiate weight gain, peripheral edema, in which Patrick is demonstrating within his leg, as well as inflammation of the organs such as the kidneys. Due to Patrick's worsening left-sided heart failure, he is now at risk of developing right-sided heart failure. As mentioned previously, left-sided heart failure can cause blood to back up in the lungs and cause pulmonary edema. As a result, the right ventricle becomes stressed as it is pumping against a greater pulmonary resistance and pressure from the pulmonary edema. This causes blood to back up in the right ventricle as well, resulting in right-sided heart failure as the right ventricle undergoes remodeling and loses contractility the same way that Patrick's left-sided heart failure has occurred. Patrick's COPD also increases his risk of right-sided heart failure. Due to his COPD, areas of his lungs do not receive enough oxygen to exchange with blood. His body will try to remedy this by constricting blood vessels leading to the areas of the lung with impaired gas exchange due to COPD. This also results in an increase in pulmonary blood pressure, which again can cause right-sided heart failure.
Hypernatremia and hyperkalemia levels can contribute to the impairment of water balance, renal function, and hormonal abnormalities that are responsible for fluid and salt balance and a decreased sensation of thirst, most commonly perceived in the elderly population, like Patrick, who is 78 years of age. These symptoms of prediabetes can decrease Peter's distal renal flow, in which can contribute to excess potassium levels within the blood illustrated within his blood results, as well as changes to his neurological state as shown. Patrick is experiencing low levels of calcium, hypocalcemia, which can result from disruption of the parathyroid gland, diet, kidney disorders, or particular drugs. Low calcium production can cause stimulation of skeletal muscle due to an increase of permeability to the nerve's membranes, resulting in spontaneous spasms, as well as cramping, stiffness, and in some cases arrhythmia and neurological changes as shown. In Peter's case, he is categorized as overweight due to his BMI of 29.3, as well as his low levels of HDL and high levels of LDL and triglycerides, known as dyslipidemia, indicating signs he has high cholesterol, which in turn increases the risk of acquiring prediabetes, as well as risk of experiencing another myocardial infarction and neurological changes as shown. Patrick could be suffering from hyperglycemia due to lifestyle choices reinforced by his BMI of 29.3 and potential indication of prediabetes or diabetes 2 caused by insulin resistance, which is the inability to maintain adequate blood glucose. Hyperglycemia has the potential to damage the kidneys, ultimately disrupting the erythropoietin hormone to adequately produce red blood cells from bone marrow, resulting in anemia, low hemoglobin count. Anemia can cause the heart to beat faster in order to circulate more oxygen around the body, reinforced by Patrick's heart rate of 155 beats per minute, as well as experience neurological changes as shown.
One blood test result which would also likely be abnormal is the level of brain natriuretic peptide. The major function of BNP hormone is to reduce the stress placed on the heart. It does this by lowering blood pressure through vasodilation, as well as inhibit the renin-angiotensin-aldosterone system by promoting urine excretion to lower blood volume. Usually the BNP hormone level in your blood should be low. However, the levels increase in the event of heart failure. Cardiomyocytes in the ventricles secrete BNP in response to stretching of the ventricles due to increased blood volume. As mentioned previously, following an MI, the heart may undergo ventricular remodeling to compensate for the lost muscle cells in the heart. This ventricular remodeling results in the dilation of the ventricles. As of such, Patrick's level of BNP in his blood is expected to be high, as he has been diagnosed with worsening left-sided heart failure.